very outset, I would like to thank God Almighty for having blessed us with this beautiful day and for having blessed us with this rural health center. Our commitment towards the people of our state and towards the health sector. In the last 7 years, many areas, including important infrastructural interventions in upgradation of equipments, interventions in terms of additional manpower, intervention even in terms of different policy matters have been taken, which has transformed the health sector to a large extent. I remember 2018, Meghalaya had the highest rate in terms of maternal mortality. We were having over 220 deaths per lakh in maternal mortality, which was double that of the country, which was at 113 per lakh. And I'm happy to inform you that in a matter of few years, because this maternal mortality has been there for quite some time, but in a matter of few years, to be precise, about 4 years of intervention, we were able to reduce our maternal mortality by 50%. And today, Meghalaya is at the national average. Similarly, even in infant mortality, we have seen a drop of close to 40%. And this has not just happened because of routine exercises. This has happened because there have been specific, innovative interventions, investments, expenditures and spending in the health sector, which have led to this achievement that the government has had. So I do urge that while we are serving the people of our state in this area, remember to be always kind and courteous to them. They are suffering, they will be suffering, they'll be having different ailments. But just your healing touch, your smile, the small care that you give them will give them the comfort that they need. And therefore that is really important to remember. I always tell our doctors, even in the government, that we must always remember this part of healthcare, which we sometimes tend to forget because there is so much of pressure, so much of patients coming in that we tend to forget the care part. But we must remember that without the care, the healthcare word is incomplete.